Welcome to Pediatrics, Chapter 26, 21st Century Pediatric Nursing. Your objectives for this chapter are to define the terms mortality and morbidity, identify two ways that knowledge of mortality and morbidity can improve your health care, list three major causes of death in the infant, early childhood, later childhood, and adolescence, list two major causes of illness in childhood, define the term nursing diagnosis, and define evidence-based nursing. Health care for children. Millions of children and their families have no health insurance in this country, which results in a lack of access to care and health promotion services. These statistics are old on this slide, but that's what the book has. I doubt if it's testable material. Major goal for pediatric nursing is to improve quality of health care for children and families. Healthcare 2020, Healthy People 2020, Health Promotion, Development, Nutrition, and Oral Care were three of the things that they were looking into to correct in Healthy People 2020. Healthy People goals were to increase quality and length of healthy life and eliminate health disparities. And I can tell you that they did not reach those goals. I'm certain that these goals will carry over to Healthy People 2030. Healthy development of our children should always be at the forefront of caring for any children. And that can be done through good nutrition, oral health, and exercise. Childhood health problems, obesity, and type 2 diabetes, big problems in this country right now. Childhood obesity is the most common nutritional problem in the U.S. If you sit and watch kids in the park or at the mall or anywhere where children congregate, it'd be easy for you to see that this is a fact. Too many video games and too much television have become the babysitters of this and the last generation. Preventive strategies need to start in infancy and even in the prenatal period. Lifestyle changes for the whole family may become necessary. Obesity leads to diabetes, and that's a horrible disease to have to put on your child because all they eat is takeout and junk food. But that's what everybody in the family eats, so that's what they get used to. Look what this child is having for lunch. Looks like potato chips and gummy bears and a thing of Oreos. And you can plainly see that he is overweight. There's a website for your Healthy People 2020. And this is how the American culture's intake of high-calorie fatty foods contributes to obesity. I think this child's a bit young to be driving the car. What do you think? Motor vehicle accidents are the leading cause of death in children and older than 1 year. The majority of fatalities involve occupants who are unrestrained. So not only is he too young to be driving, he's not even wearing a seatbelt. If you look on page 692, box 26.2, for childhood injuries and risk factors, it will explain this a little bit more in detail. This is a picture of a child who's in a pool. Don't see any parents around. They're probably right there, but you can't see them in the picture. Drowning is one of the leading causes of death. Children left unattended are unsafe even in shallow water. If they slip and fall and knock themselves out, they will not be able to upright themselves and they will be gone. Every summer on the news, there are news stories about children drowning, wandering off, getting into a pond, falling into a pool, not being watched, and drown. Burn-related injuries commonly occur in the home as a result of distraction. Plainly, you can see this mother and child are fixing to get hot water poured all over them because the mother is not paying attention because she's on the phone. Improper storage and poor supervision are contributing factors of firearm-related deaths. These injuries happen in children more often than not between ages 5 to 14. Carelessness on your part is no excuse. Watch your children. Do not ever think that someone else is watching them. They are your responsibility. To leave a plastic bag within the reach of any infant is totally irresponsible. You have to watch those babies. Those little hands are get into everything. Poisoning causes a considerable number of injuries in children. Medication should never be left where children can reach them. Lock those medications up when children are around. We need to remind grandparents and other relatives also to do the same thing, and that includes alcohol and tobacco and whatever other products you might have laying around your house. Infant mortality is the number of deaths per 1,000 live births during the first year of life. Neonatal mortality is in the first 28 days of life. Postnatal is 28 days to 11 months. The United States lags behind other nations in these numbers. Birth weight, major detriment of neonatal death. And we learned in OB that low birth weight infants are infants that are less than 2,500 grams, which is 5.5 pounds. Death rates for children is your childhood mortality. Death rates, children above 1 year of age are less than for infants. Ages 5 to 14 are the lowest death rates, and sharp increase occurs in adolescence from injuries, homicides, and suicides. Childhood morbidity is specific groups of children have increased in illness, morbidity. Those are children that are homeless, living in poverty, low birth weight, chronic illness, foreign-born adopted children, and children in daycare centers. The largest population of homeless in the United States right now today is families with children, and that is very, very sad. The art of pediatric nursing. Philosophy of care, the American Nurses Association's definition. Family-centered care recognizes that the family is the constant in the child's life. They are the experts on their child, and we need to listen to them when they tell us that there's something wrong with their child. Attention to full range of human experiences and responses to health and illness without restriction to a problem-focused orientation. Integration of objective data with knowledge gained from an understanding of the patient or group subjective experience. Application of scientific knowledge to the processes of diagnosis and treatment. Provision of a caring relationship that facilitates help and healing. The systems need to support, respect, encourage, and enhance the strength and the competence of the family. Needs of all the family members need to be addressed. Concepts of enabling and empowering need to not be forgotten. Atraumatic care, therapeutic care in settings by personnel and through the use of interventions that eliminate or minimize the psychological and physical stress experienced by the children and their families in the healthcare system. Settings refers to the place the care is given, whether it's at home, in the hospital, or any other healthcare setting. The personnel includes anyone directly involved in providing therapeutic care. Interventions range from psychologic in preparing the children for procedures to physical by providing a space for the parents to stay with the child. Physical stress can be eased by eliminating the psychological distress of anxiety, fear, disappointment, shame, sadness, or guilt. The overriding goal in providing atraumatic care is to first do no harm. That may not be always possible when we have to do things to the child as a patient. They need an IV, we need to give them a shot. It's going to hurt. but for the most part, we want to first do no harm. There are three principles that provide the framework for this statement. We want to prevent and minimize the child's separation from the family. Promote a sense of control. Give them choices. Do you want this for breakfast or that for breakfast? Prevent or minimize bodily injury and pain. The guidelines box on page 697 is very important for you to read, as well as box 26.4 on page 695. Therapeutic relationships are essential foundations for providing high-quality nursing care. Being a patient advocate is very important as a nurse. As an advocate, we ensure that families are aware of all the services available to them and keep them informed about procedures and treatments. Health teaching may be direct, as in teaching a class, or indirect by helping the patient and parents understand a diagnosis or medical treatment. And anticipatory guidance is always important in pediatrics. We must teach the parents what to watch out for and help them prevent accidents. No one person is the best parent in the world, and though a lot of experts have written books, every child and family are different. As a pediatric nurse, if you think the family or pediatric patient needs support or counseling, then make a referral to the social worker or recommend support groups for whatever the child has that they've been diagnosed with. As a nurse, we work in collaboration with other professionals to create the best plan for the patient. Ethical dilemmas arise when competing moral considerations underlie various alternatives. See page 698 about research and evidence-based practice. The process of providing nursing care to children and families, you all know the nursing process. You have assessment, nursing diagnosis, outcomes and planning, implementation, evaluation, and do not forget that documentation, although this is not one of the 5 steps of nursing, in the nursing process, it is essential for evaluation. The nurse can assess, diagnose, and identify problems, plan, and implement without documentation. However, your evaluation is performed with written evidence of progress towards your outcomes. Quality of care refers to the degree in which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Please read more about these things on page 700 in your chapter. Your question says the leading cause of death among African American boys ages 15 to 19 years is A, suicide, B, HIV, C, firearm homicide, or D, occupational injuries. In the Jacksonville area particularly, I'm afraid the answer is C. We hear about this on the news locally every morning. Very sad. Hope we can get control of that one day. This concludes our PowerPoint for this chapter. Thank you.